you ever felt ill, but no one seemed to believe you? Have you ever struggled to receive the care or diagnosis you needed? If you answered yes to either of these questions, you're not alone. My name is Gabby Waitman, and I am a breast cancer survivor. I was diagnosed with high-grade aggressive breast cancer in my 20s. I know you're probably thinking you're too young for cancer. I hope that my diagnosis can open your eyes to the fact that you're never too young for cancer. Sometimes you need to be your own advocate. Through advocation, I was able to find someone who believed and addressed my illness. Today, I'm going to inform you about breast cancer disparities in Indian country. First, I'm going to tell you about breast cancer statistics. Second, I will tell you about barriers Native Americans face when trying to receive a diagnosis. Third, I will explain some ways on how we can address these disparities in Native Americans. Now that I've told you a little bit about myself, let's move on to breast cancer statistics. According to the research of the American Society of Clinical Oncology, an estimated 297,790 women will be diagnosed with invasive breast cancer, and an estimated 55,720 women will be diagnosed with non-invasive breast cancer. I was diagnosed with both. Further statistics stated by the American Indian Cancer Foundation find that not only is breast cancer the most common cancer found in women, but 1 in 8 women will receive a breast cancer diagnosis in their lifetime. For Native American women, breast cancer is the second leading cause of cancer death. Increased risks include your age, being 40 or older, being a female, family history of breast cancer, genetics, and breast density. It is important to note that men can also get breast cancer. Now that I've told you a little bit about breast cancer statistics, I will tell you about barriers Native Americans come across when trying to receive a diagnosis. The research of Guadagnolo et al. And the Department of Health and Human Services confirms poor cancer outcomes and high-risk cancer behaviors in areas of low health care access for Native Americans, especially in rural areas and on Indian reservations. Government-funded programs like IHS make it difficult for First Nations to receive medical intervention off the reservation, as they do not believe funding for transportation is necessary. Native Americans consistently show lower cancer screening due to the low quality screening in rural areas or Indian reservations. For urban Indians, if they don't live by an IHS care facility, they won't receive the chance to even get screened. Now that I've told you about breast cancer statistics and barriers to receive a diagnosis, I'm going to inform you about some ways we can address breast cancer disparities in Native Americans. One way is through education. American Indian Cancer Foundation states that women over 40 should be screened with a yearly mammogram. Breastfeeding, weight control through exercise, limited alcohol use, and self-breast exams can also help. For women under 40 who can't receive a mammogram yet, learning to do a self-breast exam can save your life. We can do this on the first of every month to become familiar with our bodies and advocate for ourselves if necessary. This is how I found my lump. Some of the signs we can feel and look out for in a self-breast exam are any abnormal changes such as bumps, thicker areas with large lumps, fluid leakage, sores, changes in the size or shape, dimpling, areas that look inflamed or hot to the touch, flaking, or distinct vein growth. Today, I informed you about breast cancer disparities in Indian country. We talked about breast cancer statistics, the barriers to receive a diagnosis, and how we can address these breast cancer disparities in Native Americans. Being your own advocate can be intimidating, but it is sometimes necessary. You know your body better than anyone, so please do your self breast exams on the first of every month, especially if you are under 40. If something does not feel right, seek the opinion of a medical professional. If at first they don't believe you, don't be afraid to get a second or third opinion if necessary. And remember, you're never too young for cancer. Asko Be in good health, family.